So here I'm going to an outline of the subject in a course of study or teaching, leadership and management syllabi, and the subject code is 1011, and it's contained 3 credits. So nursing, leadership and management, both as a research area and as a practical skill, encompasses the ability of an individual's, groups or organization to lead, influence or guide the other individuals, teams or entire organizations. The word leadership often gets the view as a contrasted term, and nursing management here. So nursing management consists of a performance of the leadership functions or decision making within organizations employing the nurses. Nursing leadership and management include the processes common to all management, like planning, organizing, staffing, or controlling, right? We need it to make a leader and continue the activities. So because when students come to my school or our school, we always help students and helps to get the professional achieve and professional achieve their goals. So this is our basic target. Also, it is important to let you know, when students finish or get the license, most of the times they say, I feel well prepared to take the NCLEX, right? Because it gives you the enough information. When you go through the course, enough information, when you reading all of the materials with rationale. So nursing leadership and management course compositions here. Course focus the leadership management and roles, ethical decision making process of professional nurse in diverse the multicultural setting. It provides the student with a theoretical and clinical knowledge that is necessary to actualizations of the roles and registered professionalism. Students will learn how to apply the role of registered nurse with emphasis and delegation, supervision, information technology, how to use, conflict management, telehealth, and also gender sensitivity. So in this, when you finish this program and when you apply it in your professional life, every student will able to delegate to others. They will be able to supervise the new nurses. They will able to use how to information technology apply for nursing science. They're able to lead the team, make the leader, and very effective management system, conflict management. Telehealth is a new in our health system. So when you work in rehab center or hospital, we have a telemedicine. So you see the patient has this problem, you call a doctor, send a request, doctor will call you, audio visual system, patient can talk. It's save time. So upon completions of this course, student will able to apply critical thinking skill. How you get it? From your anatomical and physiological knowledge, and guide the decision regarding the nursing practice for individuals, groups within a complex healthcare delivery system. Adapt therapeutic intervention to assist individuals and groups in the promotion, maintenance, and restoration of health in the role of provider and manager of patient care. Utilize professional standard when managing the care. Demonstrate appropriate communication strategies when interact with individual, families, and groups. Right? So therapeutic communication is very important. How you talk, what is your body language, right? Your movement of the hands. So incorporate evidence-based practice into the nursing and nursing care for individuals, groups, and family. Demonstrate responsibility to nursing and society based on information of professional standard and ethics, the role of manager of patient care. So when we practice with patient, always we have to follow some principles we call nursing ethics. So we will be equal to all. We will always be truthful, never harm to the patient, right? Also critically analysis, integrate leadership research findings into the total plan of care for selected group of the patients and their families. Apply the principle of advocacy and teaching the everyday care of patients and their family. Recognize the role of nursing in policy making related to the healthcare service at local, state, national level, also global level. Like pandemic, COVID pandemic, last 2 years we went through. So it is global problem. So we need a leader who can face all of this problem, right? So nursing management or manager are responsible for assessing the nurses to specific cases, predict and description for potential ethical dilemmas within the clinical organizations and professional nursing. So ethical dilemma, very important, right? It is important for your patient if patient need it. Collaboration with the clients, significant others and members of the healthcare team to ensure the continuity of care across the discipline. Demonstrate effective prioritizations and time management skill to provide the cost-effective care and also groups of clients. Use the leadership and time management skill to practice delegations and coordination of care. What else? The clinical objectives. At the completion of ethical rotations, student will be able to demonstrate the professional standard of moral, ethical, and legal conduct. Demonstrate the professionalism, include attention to apprehension, respect to the self and others, and attention to professional boundary with patients and family, as well as the caregivers. So what else? Next here, implement the holistic and patient-centered care that reflect understanding of ethicals and legal issue, right? Human growth, development of disease or pathophysiology, pharmacology, medical management, and nursing process management across the health issues continue for adult and acute hospital setting. So what we learn from our nursing school, our anatomy, how body build muscle, ligaments, joint, system by system, and how they work. It is physiology. When anything is problem or defect, disease, we call pathology. So we have anatomical knowledge, we have a physiological knowledge, and disease process called pathology. And then when pathology or disease occur, we need to give the treatment we call pharmacology. But as a good nurse or medical person, we have to coordinate what we learn with our skill, and we have to apply it. So during the application of our skill or knowledge, we have to follow some ethical issues, right? Ethical issues means, like an example, I said, we always be truthful to the patient. We obligation one incur or might incur through the acting or falling to act, right? We always neglect any kind of negligences, or we avoid malpractice, right? Always be beneficents to the patient, right? We avoid any kind of assault, battery, false imprisonment. It is a part of our principle of ethics, right? And as a leader or management or professional issue, we have to follow all of them. Delivery, a compassionate, patient-centered. Whatever we do, everything is patient-oriented, patient-focused. Because patient come to hospital to be cured, to get comfortness. Also, what we learn, what is good for the patient, we have to follow all of this. It is called evidence-based care. Create the safe care environment and that result high quality patient outcomes. Provide appropriate patient teaching that is reflect the development stage, age, culture, spiritualities, patient references, health literacy, and considered to the foster patient engagement in care. Also demonstrate the critical thinking skill in implementing evidence-based nursing intervention is appropriate for managing acute and chronic care of adult patients. Demonstrate the application of psychomotor skill for efficient, for safe, and compassionate delivery of patient care. What else? Next here, monitor the client outcome to evaluate the effectiveness and psychobiological intervention. Collaborate with other healthcare professions. So my patient is diagnosed with tuberculosis. Patient needs the chest radiography, right? You have to talk to the radiology unit before send your patient. A patient need long-term care, hospice center, you will communicate with them. Then patient will be there. So it is easy for the patient, right? Because you organized everything before. So in this course, what are the books we recommend for you? So the books, references, and other resources. We can use medical, surgical, nursing books, right? It is usually 8th edition. And also the name of the publisher here. The Standard Comprehension Review for NCLEX RN. Critical Care Nursing, Diagnosis and Management, 9th edition by Linda. It is a writer name. And also we always love to request our student to follow this one: prioritizations, delegation, and assessment. Practice the exercise for NCLEX exam. Wonderful book. What are the other course outline? We follow Foundation of Critical Care. It includes critical care nursing practice, ethical issue, some legal issue, right? Ethical issue that I already told. So like we no negligency, always beneficial, non-maleficent, avoid assault, battery, false imprisonment, right? We also follow some legal issue like good Samaritan law, incidents reporting, Harrison Narcotic Act of 1941, advanced directives, advanced care of medical directives, or durable power of attorney, healthcare proxy, or living will. This is called legal issue, right? Also, genetic issue, facilitate the care of transition, right? We always follow the HIPAA, Health Insurance Portability and Accountability Act, right? We have to, which is also the legal issue. The psychos here, Foundation of the Critical Care Nursing, it is psychosocial and spiritual consideration. So my culture is important to me. Whatever your culture does not matter. So we are nurses, we work in the floor. So it is my patient. So if my patient has a belief or trust in relationship, I do not have any problem. So let them do this, right? Always be neutral. Don't bias by your own emotion, right? It is important. So religious and spiritual influence of health, every student must know. Nutritional alterations and management, how to pain management, sedation, agitation, and delirium management, including in critical care nursing. We will discuss in this course. Palliative care, nobody can avoid, right? It is our destination. Everybody will be older, and final destination is death. So if it is final, we have to accept it. But we always help to the patient peaceful death, painless death, right? Palliative care, hospice care is important, where we can provide complete care, physical, mental, religious, and spiritual care. So also here next is pulmonary alteration, including in this subject what we will talk about: pulmonary diseases, lungs anatomy and lungs how function, physiology, lungs critical assessment, lungs assessment, disease diagnosis, pulmonary disorder, pulmonary therapeutic management, right? So if your patient diagnosed shortness of breath because of bronchitis, if patient is young, less than 2 years, If patient has asthma, is our diagnosis, right? It is the pulmonary disorder. What are the diagnostic procedure? Take a good proper history, diagnostic test, and then we give the treatment. We call therapeutic management, complete management, including the treatment. So cardiac alteration, heart problem, right? Cardiac anatomy and physiology. The structure of the heart, how many chamber, right? How many valves, how action potential work, systole, diastole, physiology, cardiac assessment, diagnosis and procedure, disorder, and cardiac therapeutic disorder, therapeutic management, right? What else? Neurological. It is include neurology of anatomy, means brain and spinal cord function, anatomy and physiology. Clinical assessment, diagnostic procedure. So if my patient has a myasthenia gravis, Alzheimer's disease, Parkinson disease, we have to know what are the clinical presentation, what are the nursing intervention, and what are the management, and what are the side effects of medication. Because neurological drugs sometimes can cause extrapyramidal symptom. So if you do not know what is extrapyramidal sign symptom or tardive dyskinesia, abnormal movement, how you call a doctor that my patient have this problem, need a better management, disorder, and therapeutic management is important. Multi-system alteration, any kind of trauma, shock, sepsis, multiple organ dysfunction, brain, sorry, burn patient management is so important. Patient need Hartmann solution, fluid management important. Organ donation and transplant, we have to follow the protocol, right? So example, organ donation. So healthcare provider determined if the organ is suitable before approaching the family, or organ should be removed within 1 hour of the client's death. So you have to educate the family. Or each hospital has its own protocol regarding the organ donation. You know this, your patient do not know. You have to educate them, right? So donor must be kept on the life support until organ are removed. Very important. So like hematological and oncological emergency, we also discuss in this course. Some special population, they need a special care, like older adult client, for prevention of the fall, pediatric patient, any kind of asphyxia, most common, danger of poisoning, obstetrics patient who is ready to deliver a patient, right? Pregnant mother care is important. They need a special care. What else? Now, here, instructional delivery plan. So in this course, how we deliver to you, because we want to print something in your brain, right? Because we really like to care of you. So the format may include lecture, decision, the lecture and discussion, computer assist learning system, group or individual learning activities, and each week you will complete the various combination of online and classroom assignment. So your instructor will give you the pathway, what assignment, what date, activities, reading, and other method including in this course. Instructional strategies that may be used include lecture, discussion, demonstration, media resources, like we will provide some important YouTube link or other recordings. Role playing, because when you see and when watch and listening both work together. Some kind of stimulation, team-based learning strategies, audio visual aid, computer assist instruction, and study and practice groups, case studies, critical assignment, clinical assignment, and also supervision by the instructor, post-clinical conference, critical thinking tools on assign the patients, practice and return, demonstrate at the campus laboratory. We call remodeling. So what I do, then I request, can you do it for me, please? So you can show me and you will not forget when you do it by yourself. So what else? Instructor or student responsibilities. What is our responsibilities? So instructor in this course assume the responsibility to provide information regarding expectations of the student on required the assignment and activities and date for completion. The major obligation of the student is to demonstrate the proficiency while meeting the requirements for this course. Included in this obligation necessarily of meeting timeline for completion of activity, assignment, and test. What else? Next here, the course requirements. What are the dress code and other resources? Students are expected to wear the school uniform when coming on campus. No other will be permitted, no other kind of. No eating or drinking is allowed in the nursing skill laboratories. For the student safety, student must not wear the sandals, fabric shoes, or shoes with open toes or open back. Student will not be permitted into the nursing skill laboratory with proper attire or either the class. Supervise the practice, performance the testing. The student must conform to this guideline. Students have a maximum of this opportunity to demonstrate the proficiency at the skill during performance examinations. Fitness minute will be allotted for each skill test, and student will receive either pass or fail grade, right? Based on meeting or critical elements and override for each skill tested. Student require of the third test will be tested by two faculties within the course have other than the original examiner. What else? The method of communication grade. Result of each performance examinations will be given to the student in writing immediately after performance of the skill, and student must pass the skill performance examinations of mandatory skill, also randomly selected skill to pass this program or course. How makeup test, and there will no makeup examinations and attendance. So because of concentration of learning in this program, attention at every scheduled session is imperative. Students who miss any scheduled class are responsible for acquiring the missed information, right? Also consider of the other is expected. The class participation. The class participation is an expected behavior and maximize students' learning. All assessment must be completed before class, and students are expected to actively participate in the class by performing the skill under the supervisions of faculties. So if any student did not complete the course, or if a student need to review all of the materials, right? What are the rules and regulation is remediation. Students who are not meeting the course objectives and or requirements are expected to practice in nursing skill laboratory and to look for assistant of the tutor and or other instructor. It is the student responsibility to make an appointment with the course instructor for direction of regarding the remediation. So what else? The nursing skill and laboratory, the students are responsible for assign reading the textbooks and completing all videos and other assignment prior to the lab. So every instructor will email you or will show what are the Google Classroom and what are the content. And you have to finish all of the materials before participate in our simulation lab. Participation in discussion over assigned materials is expected. Failure to prepare all result in a unsatisfactory for lab session. All lab session must be completed satisfactorily to progress to the clinical setting. Student must adhere to the clinical dress code for skill laboratory session. Refer to the nursing student guide for policy informations. What else? The clinical experience. So clinical attendance is mandatory. Refer to the nursing guide for absence policy information. Before you come or participate in the clinical, make sure you are fully vaccinated. Immunization history, you have CPR card, TB status. If you are PPD positive, it is important to show your chest X-ray or quantiferon gold standard test must be negative. A student will allow to perform designed nursing skill and clinical setting often after receiving the instruction and successfully demonstrate the skill in nursing skill or laboratories. Nursing skill in laboratories. Students are expected to meet the clinical expectations or based on the student learning needs. Faculty will determine the appropriate amount of time and clinical assigned needed to assess the student growth. Faculty may require additional assignment and clinical work to ensure the student have met the clinical objectives, and students are expected completely complete with any additional assigned and clinical hour assigned. Students are expected to prepare for clinical practice in order to provide safe, competent care, and also clinical assignment must be handed in on time to the clinical instructor and no exceptions. Here I'm going to explain a little bit more the method of evaluation to grade and also the grading scale. Here you can see what are the method and what are the percentages. So homework and participation 10% and NCLEX question each week. You have to have the target 100 question per day or 300 question per week. If you complete, come 12% and quizzes 8%. What else? Here showing midterm exam 20%, midterm 2 20%, your final exam 30%, and all together 100%. Here we say what is the grading scale. You say if you get in between 90 to 100, you'll get A. If your numeric grade is in between 80 to 89, you're able to get B. If it is 79 to 75, it's C. Less than 70 means failed. So below 75% is a failing grade, right? Here showing the clinical grade is simply pass and fail, right? Following are the score that will given on the scale. Like if you do first attempt successfully, you get 100%. Second, 89%. And third attempt, 79%. Right? Like I will show you how to mixture the insulin, right? And if you do it remodeling, the first attempt 100%. So all skill makeups or retake will be made up during open lab hours. Student will have until the end of the unit to make up or retake any skill, or grade will automatically be changed to 0. Right? Very important. Now here we are showing what are the course schedule or calendar. Here it is the week, date, and what are the classroom activities, and what are the textbooks, and what are the assignment we follow. Week 1, basically we talk foundation of critical care, part 1, chapter 1 to 5. Critical care nursing by the book called Linda. The chapter, page number 1 to 33. Week 2, foundation of critical care, part 2, chapter 2 to 10. Critical care nursing by same book by Linda, page number 74 to 8166. Week 3, pulmonary alterations. Usually in this book, unit 3, chapter 16, 17, 18, 19, and 20. Week 4, we talk cardiac alterations. Unit 2, chapter number 11, 12, 13, 14, and 15. So quiz 4, page number in the book, 167 to 420. Then you can sit for midterm. Week 5, neurological alterations. Unit 4, chapter 21, 22, 23. Book name Critical Care Nursing by Linda. Page number 534 to 625. Week 6, multi-system alteration. Chapter 33, 34, 35, 36, and 37. Critical Care Nursing by Linda book, page number 791 to 952. And week 7, the special population means elderly patient, then pregnant or obstetrics care, right? So, and also the chapter 89, chapter 38, 39, and 40. Critical Care Nursing by Linda, book name, page number 953 to 1018, and skill practice on campus when you come to the school. And week 8, we're supposed to talk comprehensive review. So all will be review. So you will become prepared to participate in the clinical lab or simulation lab. So comprehensive review is important. And finally, when you've done each and everything, you have a clinical check off. So what we discussed up to now, if you understand, then you can type, you can write your name. It is called acknowledgement. If you understand everything with your conscious mind. If you have any question, you can ask us. We will try to make you clear. And we are very happy to assist you. So then, like your name is here, I have received and understand the syllabi and containing the policies and requirements for NUR 111 course. I have reviewed the syllabi and understand the objectives of the course, and I understand how my performance will be evaluated and how my final grade will determined, right? So if you are agree, then you can type your name is here, and then you can give signature, and you can write the date here. When you've done all of this, you can email to the school. Thank you to listening us.